In this video, we're going to be learning about ACE inhibitors. Check out my previous video on RAS, renin-angiotensin-aldosterone system, to understand this better, because ACE inhibitors just does the opposite action as that of what RAS system does. Angiotensin converting enzyme inhibitors, as the name indicates, inhibit ACE or angiotensin converting enzyme. As you know, angiotensin converting enzyme or ACE is responsible for converting angiotensin 1 to angiotensin 2. So since there is inhibition of ACE, there is no conversion of angiotensin 1 to angiotensin 2. And hence, this causes to increase in the levels of angiotensin 1, whereas the angiotensin 2 levels tend to decrease. And as you know, angiotensin 2 stimulates the release of aldosterone from the adrenal cortex, and hence the level of aldosterone also decreases. And hence, the end result of all of this is majorly will be vasodilation, which in turn causes the BP or blood pressure to decrease. It also decreases the renal vascular resistance, increase the renal blood flow, and promote sodium and water excretion, as opposed to the RAS system, which causes the reabsorption of sodium and water. Here, excretion of sodium and water occurs. So just the opposite of what RAS does. Now, all of the ACE inhibitors end with pril. Example: captopril, enalapril, lisinopril, ramipril. The uses of ACE inhibitors are for the treatment of hypertension. They are the first-line drugs in the treatment of hypertension. About 50% patients of essential hypertension respond to monotherapy with ACE inhibitors. Next use is for myocardial infarction. ACE inhibitors reduce early as well as long-term mortality. It's used in congestive heart failure as it causes both arteriolar and venodilation and hence decreases the preload and afterload. In diabetic nephropathy, a prolonged ACE inhibitor therapy has been found to prevent or delay end-stage renal disease in type 1 and type 2 diabetes. In scleroderma crisis, marked rise in BP is reduced by ACE inhibitors, and also it improves the renal function. The side effects of ACE inhibitors are persistent dry cough. This is due to increase in bradykinin levels. ACE is known to degrade bradykinin, and since now the action of ACE is inhibited by the ACE inhibitors, bradykinin levels increase and hence persistent dry cough occurs. The other side effects are rashes, hyperkalemia, angioedema, which result in swelling of lips, mouth, nose, larynx,